Hi, you're listening to TALRadio of Touch a Life Foundation. This is Robert Hicks, and we're going to have an interesting conversation today with Dr. Melinda Drake, the CEO of MFI Recovery Center. Thanks for coming on TALRadio, Melinda.
Thank you for inviting me.
You're very welcome. I understand you're coming to us today from Riverside, California, correct?
Yes.
And MFI Recovery Center is a California-based, full-service 501c3 nonprofit behavioral health organization that provides high-quality treatment to adults and adolescents with issues related to things like substance abuse, mental health, and family problems, right?
Yes.
So how long have you been the CEO at MFI Recovery Centers?
Oh gosh, I came to MFI last December 2018.
Okay. And can you tell us a little bit about your background? What brought you to MFI Recovery Centers?
What brought me here? I got tired of West LA, I guess. How can I say it? Well, I've been all over the country, from working in, chronic mental illness, and found myself, as far east as South Carolina, as far north as New York State in the North Country, working in the substance use field, as far west as Hawaii. And when I had the invitation to come to California from a high-end substance use program for dual diagnosed, I decided to go. And I guess my change to MFI is, in my career, I always vacillate between the for-profit and the not-for-profit world. And so this is actually my turn to give back again. And so that's why I'm at the not-for-profit right now, to work in this field again for people who are in need of services, but most times they're not, can't afford it.
Okay. And so I understand you've got more than 20 years of experience as a social worker.
Oh gosh, no, I have more than 30.
More than 30, okay.
Yeah, I'm pretty old.
So also am I. So let's talk, if we can, a little bit about some of the services that you're now. First of all, give our listeners. By the way, our listeners are a global audience, so they could be anywhere around the world. And essentially, you were telling me that you have an excess of, I guess, 10 locations, but you're really located entirely in California. Am I correct?
Yes. Yes, we're located just in one county, Riverside County, but we're across the county from what they call the Western region, where Riverside is, and we're as far east as Indio. So we're scattered in the 3 regions of the county.
Yeah, and I saw, like, on the website, I guess maybe there are 5 major locations or something that I saw listed that were like Riverside, San Jacinto, Banning, Murrieta, and that last
San Jacinto, Banning, Murrieta, Hemet, Palm Springs, and like I said, in just the easternmost area that we have.
Oh, okay, wow. So even more than I was reading about. It's my understanding that you kind of basically are focused on high quality and affordable substance abuse treatment and mental health programs, right?
Well, it's actually a lot more than that. What got me to join MFI is because, you hear from so many people that they're integrated. And when they talk about integrated treatment, they only are talking about integrating mental health with substance use. The problem part, though, is that that's kind of not enough. And I joined MFI because MFI was one of the first programs wherein I've heard them really working on developing their primary care. And we actually have a primary care clinic in one of our clinics here in Riverside. And so when they say integrated, we really are looking at working with the person as a whole person, meaning dealing with their primary care issues, their physical health issues, their mental health issues, as well as their substance use issues. And having said that, as late as a year and a half ago. We are in a project with the Inland Empire Health Plan to actually look at diabetes management and medication management among our population. You know, a lot of people talk about the probability that there's a high number of people in behavioral health that may be dealing with diabetes, but there has not been any study about it. So this year we actually started that work. We look at the prevalence of diabetes among the people that we serve, and we also look at is what we're doing helping lower that probability of somebody leaving our facility still with diabetes, or can we manage diabetes for them? And so that's what some of the things that we're doing.
Yeah, so you really have become much more of a broader facility rather than just limited in any narrow area, right?
Yes.
Because I was seeing that on the website, I did some checking up, and it mentioned some of the services that you offer. One was medical detoxification, right?
Mm-hmm.
Tell us a little bit about that, if you would.
Well, it is sad that you do need to, number one, offer that service, but it's sad that there's a lot of people right now who's dealing with fentanyl abuse. Technically, it's opiate abuse, but we are having such a resurgence of fentanyl abuse that there's a lot of people who don't know that the drugs that they're using may be laced with fentanyl. And so part of the things that you actually have to do in order to engage somebody in treatment is to help them detoxify from the substance that they're using. So from at least two of our facilities here at the ARC where I'm at, the Arlington Recovery Community, and at our facility called Mount Rubidoux in downtown Riverside, we provide withdrawal management services, wherein we offer people dealing with either alcohol use or benzo use or opiate use, medication in order to help them basically taper out of the substance that they're using. That usually take about 7 to 10 days.
Okay, yeah, and I saw the, just stepping through some of the things that I saw as services that you offer. I saw also where it mentioned relapse prevention. Obviously, that's something that maybe a lot of us don't think about. That
one is ongoing. Nicely for the state of California, DHCS has recognized that people, even when they're in a residential facility, because our facilities are not locked, can or may relapse. Why? Because sometimes they go out for whatever event, and sometimes they find somebody who will give them something and end up relapsing with it. And just because you relapse doesn't mean that you get thrown out. I think it's a very nice way of looking at how we have progressed in treating addiction as a disease. Since 2012, ASAM had redefined addiction as a brain disease, as a relapsing chronic brain disease. But we have not treated relapse as that when somebody relapses, they treat it like they've done something so bad that they get thrown out of the program. Well, for us, when somebody relapses, we have to really work to find out, number one, why they relapse, number two, how to get them back on track. And so a lot of the work that we do is really trying to teach people that, yes, sadly, you have a disease that is chronic. The difference is that nobody's going to send you flowers when you relapse. They usually shame you, but that's not how we do things. And what we got to try to do is try to figure out why you relapse and help figure out what can you do so that it doesn't happen as much to the level that it doesn't happen at all. And finally, you're in your recovery state.
Yeah, because one of the things that I find that's really impressive and substantial about about your MFI Recovery Center is the breadth of things that you're doing. I mean, it's not just about the couple of things that we talked about so far, but also, I saw on your website you do counseling, psychiatric care, even offering primary care, right, to some of the people that are in your program?
Mm-hmm. Yes. If you look at it, after you've used the substances that you've used, don't you think your body will need a doctor? Because you've abused beyond abuse. And most people that have done that really need to get some primary care assistance. A lot of people deal with having to deal with getting hepatitis, and so we provide those type of services that know there are now new treatment that would allow you to get treated for your hep C. So we work with that. There's a lot of people who don't know because of their use that they have been exposed to some other diseases. Big ones are STDs. And so our doctors help our consumers so that they could get treated for those diseases. And even as,
Yeah.
like I said, simple things, well, not simple, but other chronic diseases like diabetes, for one. And so part of the things that we do is actually get them on the right medication so that they could be healthier. I think our approach to recovery is not just stopping using, because that most people, they think about recovery as they're no longer using the substance. For us, recovery is really doing that change of life. Although we have a lot of services that are paid for by Medicaid, we have we have good chefs cooking at all of our kitchens. We don't have clients cooking at our kitchens because, number one, they may not know how to cook the right food that will be nutritious for the consumers. So we actually have chefs cooking at our kitchen so that they could actually provide good meals that would help the person start the recovery by eating the right food. We have a physical fitness person that actually work with them so that they could start doing those exercising, because I always look at it on the root word of emotion is motion, and you cannot be in recovery if you're not taking care of the whole person. We provide yoga. Gosh, at one point, I can't find a good acupuncturist. Otherwise, I would have had one again. I did try, but it's not that simple or easy to get a good acupuncturist.
Oh, wow.
I am trying to get the acupuncturist that's working for me to come in to actually provide that. I'm still working on it, but like we said, we try to bring in that whole holistic approach of working with a person. Yes, and it's not just all spectrum. Western, because we have doctors that will prescribe, Suboxone, Sublocade, the different Vivitrol, whatever it is that they need in order to stay clean, using medication-assisted treatment. But there are also other things such as yoga that helps somebody calms down, that teach them mindfulness skills that will help them stay clean. So it's not just one thing or the other, but a good mixture of all of the things that's needed in order for somebody to stay in recovery.
A reminder for our listeners, we're talking with Dr. Melinda Drake, the CEO of MFI Recovery Center, based in essentially Riverside County in California. And we're talking about the breadth of offerings that the organization has. Melinda, how many people make up the MFI Recovery Centers, like employees or?
Oh, last count was 287. Yeah, 287? We are celebrating 50 years of providing services this year.
Yeah, and no, that's great. And you also actually have a lot of flexibility, because I heard you mention residential treatment earlier, but I also saw you have outpatient treatment as an option also, right?
We have 4 outpatient clinic, one in Hemet, Banning, Marietta, and our biggest one is in Riverside. The Riverside Clinic is also a certified community behavioral health clinic expansion through SAMHSA this year ago.
Okay. Wow. And I was also looking at some things like you also offer parenting classes. I found that kind of interesting. And just the connection of that with, people that are suffering from addiction of various types. Can you tell us a little bit about that?
Well, we provide triple P parenting. Sometimes because drug use, a person or a couple find themselves in trouble with CPS. child protective services and needing parenting classes in order to gain custody of their children again, or in order to keep custody of their children. So we provide that service at our clinics. We also try to provide that service at our residential programs.
How long has the organization been around?
50 years. Like I
Oh,
said,
50
we're
years.
turning
Okay, that's right.
50. We
You
turned
didn't
50
just
this
tell me
year.
that. And that's not what the balloons are about in the back. Those are birthday balloons.
Yeah, that's
Yeah.
for me turning over 50.
So tell me, do you, with our listening audience, basically what we are here about is, again, I'm with TALRadio, and let me mention just real quickly, TALRadio is essentially from the Touch a Life Foundation. And Touch a Life Foundation is similarly a registered 501c3 nonprofit organization founded on the principle that helping others is good for society. And what we do is we leverage technology to essentially connect those in need with those who are willing to give. And one of the things I like to always tell our listeners, we do have an app essentially for your cell phone, if you will, your mobile device. You can go to either the Apple App Store or Google Play Store, and you can download an app that is called TAL Giving. TAL stands for Touch a Life. It's the TAL Giving app, and it's a platform to help organizations like MFI Recovery Center and so many others that are trying to do the work to help others. And we often have, individuals, corporations, or whatever that have something to give to try to help them out. And we're all about essentially connecting those two parties. So what I kind of wanted to ask you, Melinda, if I may, what are some of the ways that our listeners might help the MFI Recovery Center?
Gosh, this year, I think last year, we have a new collaboration with the county called the Arlington Recovery Community and Sobering Center. And we have not worked as deeply with the homeless population as we've had with the ARC and the Sobering Center. And the difficulty that we're finding out from working with the homeless population is how many of them really come in with nothing, like no clothes in their back, no shoes, no socks, no nothing. And how many of them are dealing with chronic mental illness, that, homelessness is such a big problem across the country. And so many people are just putting, how do you nicely say it? They're throwing everything at it to try to see what's going to stick. And nicely with the ARC and the Sobering Center, just from the people that we served between February and April, about 400 people came into the Sobering Center, and out of those 400, we were able to engage 52% of them to stay in treatment. And among those people who stayed in treatment, we were able to engage about 70-something% to actually stay longer and transfer to a longer residential treatment facility. But they are in so much need for, like I said, as simple as clothes, because they have nothing. And that's kind of the sad part. Another one that we always are in need of, one of our program, AWP, or A Woman's Place, is a perinatal program. We work with women with children and pregnant women. And on that one, I'm working hard on trying to get it. It's a very old facility of ours, and like, if there's a dream that I need to get done, it's like, they need a real playground, not a baby playground, because technically it's a 30-something bed facility and there's a lot of children. And when you have that many children, things break so much faster. So those are some of the things that we're in need of. We kind of do a lot of things that people have not thought of doing. We are the only facility that actually we develop a recovery housing for families.
Okay.
because most times than not, when you are in recovery, the probability is your spouse will be in the same boat. And you ended up going in different places and they never think about, so what happened to the children when that happened? And so we actually developed, we have 3 small units on that right now. And that's kind of a hard issue that we're dealing with, is like, with the so many people that we serve, we only have 3 units because that's all that we have. And the things that we found, these are the things that you find as you work with the population. The things that we found when we started working with the chronically mentally ill is that there are no programs that really work with them when they deal with substance use issues also. That you hear the word diagnosed, but they don't talk about people with schizophrenic condition and substance use issues. And with that, we actually developed our newest house, the Sunrise House. But by design, I can't have them with so many. You can't have that many people because you're dealing with a very, very difficult condition. And it's sad because that house has a waiting list because we could only treat but so many people as we have beds.
Yeah.
And the sad part is the need is there. And as I think about it in California, I could only imagine how bad that need is across this country. Because that's kind of the bad thing, is that, what I'm seeing is just a cross section. And this is the things that you see across. And like I told you earlier, I've worked across this country, and I know that most likely than not, that similar issue is occurring in the other state, and I don't know if those services are actually available in those other states. But like I said, here we have created, gosh, at least 2, one for men and one for women, but it's always limited to the number of beds. And right now, I only have 6 women's beds and 10 men's beds.
So if our listeners wanted to help out in any way, do you accept donations, like financial donations?
Oh gosh, yes, we're a 501c3, so we are able to accept donations.
Okay, and can they do that on your website?
They're trying to put a donate button on our website.
Okay.
This is actually, it's taken us 50 years. Like, for 50 years, we've always just we do business with the county, so we earn, we earn what we make, and whatever we make, we put back to the facilities and to the staff and to the services that we provide. The sad thing is that the need is so much bigger now than where it is when I started working in this field. Now, and I think that's kind of the thing that in my lifetime, when I left, I think when I left South Carolina because I saw the children that I was working with dying, and I thought I needed to go do something that's different because I have to figure out how to stop the dying somewhere. I didn't know that the biggest reason as to why they are is because of substance use, because then I was in just pure mental health. And when you were in pure mental health, they don't touch substance use. When I moved to Hawaii, that's where I saw how many of the children, adolescents that I was working with were also dealing with substance use. And I guess that's why I'm now at MFI, to actually put all of those things together. But it's difficult because they're just not there. What we have at MFI is hard to find anywhere else because they just don't exist. You will not find recovery housing for families because there's no such thing unless you come to one of ours. You will not find a facility that could handle schizophrenic people with substance use because they're just not around until we created them. And the difficulties that we have right now is the list is long, and we could only serve as many people as we have beds.
Well, you were talking about that donate button. Hopefully, the Tal Giving app can be that for you right away. And essentially, for our listeners, the way it works is the organization, like MFI Recovery Center, would register on the Tal Giving app, and individuals, corporations, just any group at all can also register to be a participant in TAL Giving. You just download the TAL Giving app from either the Apple App Store or Google Play Store and get yourself registered on there. And like I say, it's like a dating service for the people that are generous and the people that have needs. And we're here today to hopefully help the MFI Recovery Center because doing so many good works in California. Melinda, is your organization a standalone organization only, or are you a part of any other bigger organization that
No, we're a
anybody might
single
look up?
organization. It's just
Okay.
one here at, we're just here so far in California. I hope in my lifetime that I could bring what I do here in California across, because like we said, it just doesn't exist anywhere else. And the need is so much bigger that every time, gosh, I was just in Portland a few months ago and saw how many homeless people are there, and knowing what they're facing, because I see the people that come here to the art. I wish what we have here at MFI exists in other places in the country.
Yeah. So if people want to get information about the MFI Recovery Center, they can go to www.mfirecovery.com, correct?
Yes.
Whether they're seeking help or maybe they're looking for a way to help out, there is a contact us button on the website that I saw that once you go there, MFI, it's like Mary, Frank, India, mfirecovery.com, and you can get further information or begin the process of hopefully turning around your life. So I like to ask this question, Melinda, to people that I talk to in your role. Can you tell our audience a little bit about what this does in your heart to be involved in this kind of work and having your life focused on providing these kinds of things? What's it do for you personally, beyond getting paid, but just like how does it fulfill you in some way?
Well, when you talk about how I ended up here at MFI and how I told you that I vacillate between the for-profit and the not-for-profit world, I'm pretty good at what I do. I actually have the knack of expanding what we do. When I walked in, we have 156 beds. Now we're about 300 and something. And the reason of that one is that I have this drive I see a problem and I don't complain about the problem. I do something about it. What it does for me, well, it helps me think that at least, every day that I'm alive, I'm changing something. I can't change the world, but I can change people one person at a time. I think there was another lesson. The most difficult population that I've ever worked with is a population in South Carolina. When I was working with the severely emotionally disturbed, mentally retarded at that time, children with, some of them with genetic disorders. And my mother said that after the first 3 months, I was already complaining that I have to quit because I cannot see any change among them.
Yes.
They taught me, however, that the problem was that I'm looking at change on my lens. What those children taught me is looking at change in their lens, that they're not gonna be doctors or lawyers or such, but they actually find meaningful life anyway. That they find meaningful life by being able to be the best they can be. And that's what those children have taught me. And so with the work that I do now, the same thing follows me on if there's a problem, what is the problem? How could I come up with a solution to it? Because if I don't, then who else will? And there's just
Yeah.
not many people who have the thinking of, everybody talks about the problem, but nobody ever bothers to come up with a solution. And sometimes
Yes.
people are so stuck on trying to come up with a plan that they never implement the plan. And so with the work that I do at MFI, I have 280 something people. I have a fabulous team, management team that works with me and kind of support me with coming up with the ideas. They tend to look for, here's a good example for you. We had a consumer who completed treatment. He was in a recovery housing, one of ours. He was so excited because he thought he was going to get a job. Then he didn't pass the background check. He relapsed right after that. That was brought up in a management team meeting. And with that, we discussed that, gosh, what can they do? So from there, we decided that we have to come up with how to help them get back into working. And so we developed our peer support services. Because like we said, there's a lot of problems. We will never run out of it. The problem is that even when there's solutions, people don't come up with the solutions. And so for me, it's like, I can't change the world, but hopefully I can make enough dent, that...
Yeah, you make an impact in your neighborhood. Yeah.
Exactly. It's like I have to take a bite out of the problem, otherwise, and I have 280 something people helping me take a bite out of it. And that's all that we can do.
And there's really a reason why I asked that question is because, a lot of people in various jobs who sometimes tend to question, am I really making a difference? And that's the thing that in your line of work and your organization, you probably get a lot of that feeling that you're making a difference. I would think, you see tangible results in critical areas. And one of the reasons I asked that question is to bring it up to our listeners and say, you too can experience some of that satisfaction by helping out organizations like MFI Recovery Center. Go on the TAL Giving app, go to their website at mfirecovery.com, get connected to them, donate. By the way, I wanted to ask you, Melinda, do you guys do anything in terms of seeking volunteers of any kind or no?
Oh, we actually have a lot of volunteers that come in. We have a lot of interest that comes in from different colleges. So we do get a lot of those, and we have a very robust volunteer system for that.
Okay, good. Yeah, because that's the other thing I wanted to say. Whether you're giving financially, you're giving of other things you might contribute, maybe you're giving of your time. Organizations like this are all over the place. Certainly, we've highlighted MFI Recovery Center in Riverside, California. We're delighted to have spoken with you today. Is there anything else that specifically you'd like to leave our audience with? Any parting thoughts? Anything that we might not know that you would like to make us aware of?
I think the one that I always say for people, and this one came from my own child, by the way, because my child is a writer and she's not in my field, which she's very happy writing. And she talks about when she saw one of my clinic that you would not know that is what it's for, because unless you're having a problem, you do not know that is what the clinic is about. That also goes the other way, that there's a lot of people out there who has problems that are either with mental health or with addiction, and they do not know that there are services around that they could go to. And I think if there's something that I could say to your viewership is that for people who's dealing with addiction or trauma or mental health, that you're not alone. And that across this country, I have met other providers, other facilities, other programs, but to not continue to be there by yourself. That when the problem is too big, that's when you ask for help, and that there is help. And all you have to do is come out, reach out, talk to people, and you're going to find that there is no, that there's hope for people, and that anybody and everybody has an ability to change their lives And there are people out there who's willing to help.
And that's one thing I've heard over and over again in recent years is they say that there used to be more help available and now there's not enough help and things like that. So it's certainly something that we like to do at TALRadio is to highlight and make people aware of organizations like yours. Dr. Drake, I want to thank you for joining us this afternoon, and for our conversation, we do hope that you that we're able to help you out a bit. We thank Melinda Drake, the CEO of MFI Recovery, for meeting with us today to share their story. And this doesn't have to be a one-time event. We can check in with you again later if you like. But thank you very much, Melinda.
Thank you so much for inviting me, Robert.
You're very welcome. I'm Robert Hicks, and we thank you, our listeners, for spending time with us today, and most of all, for your generous nature in following us. Please stay with us on TALRadio for additional uplifting stories that we're looking forward to telling you about. We hope you have a great day.